Happy New Year and welcome to our first episode with the Nairobi Hospital. Today we'll be discussing about cancer of the cervix, and taking us through is Dr. Kamau Koigi, consultant obs-gyn at the Nairobi Hospital. Karibu sana daktari.
Asante sana.
So today we're looking about cancer of the cervix.
Yes.
We've talked about prevention, we've talked about the treatment, and we've talked about the cost. But today I would like us to talk about prevention, which is key in avoiding the whole procedure of treating the disease.
Very true.
What are some of the things, or what are some of the things that one should consider when it comes to taking care of yourself to prevent cancer of the cervix?
Okay, so to begin with, cancer of the cervix is actually one of the leading killers in relation to cancers among women, both in Kenya and in East Africa. And the sad truth is that in Kenya, we have an average of 9 women a day dying of a cancer which is actually completely preventable. And this is literally a disaster, because if we had the opportunity to save these women's lives, then we improve the quality of life for so many families, for those patients themselves, and we increase our productivity as a nation, because we're also trying to grow. And we want as many people to have as high a quality of life as possible. So our focus on prevention of cancer of the cervix, by and large, involves 3 key areas. Number 1 is lifestyle modification, so that you can reduce your risk. So for people who have high risk taking behaviors, we modify their behaviors. Secondly is for those who are known to be at risk, that is for every woman who is sexually active, they actually qualify to go for the opportunity for screening. So by having regular visits to the gynecologist, there are plenty of opportunities to screen for cancer of the cervix, and there are various methods of screening available. There is use of the Human Papilloma Virus testing. There is directly examining the cervix with through visual inspection with acetic acid, visual inspection with Lugol's iodine, the use of colposcopy, and the use of the famous pap smear that is done. Ideally should be done annually when a woman goes to the hospital for review. And the newest kid on the block is the new Human Papilloma Virus Vaccination that has recently come out. With the introduction of this vaccine, Kenya now becomes the 10th country in Africa and the 155th country globally, which is very sad. We should have taken this up a lot earlier. And we now join the ranks of those who are offering this vaccine. So this vaccine is a very interesting new kid on the block, because it's a vaccine against the 2 most common types of the human papilloma virus that are responsible for causing cancer of the cervix, and that is type 16 and type 18. And those 2 types alone are actually thought to cause up to 70% of cancer of the cervix. And it's actually thought that by offering patients this vaccine, preferably before they become sexually active, then it should be possible to reduce the long-term burden of cancer of the cervix by over 80%.
You have touched on one of the treatment being, or rather prevention, is the HPV vaccine, which was launched in Kenya last year in October, and I was privileged to attend the function.
Excellent.
And afterwards, what came out is the doubts and the myths surrounding the vaccine. Could you demystify some of those myths, so that to encourage people who have, because it was targeting children of the age, under the age of 10, before they get to their sexual debut?
Yes.
Yes.
So one of the things that sparked a lot of controversy with this cancer of the cervix vaccine, as you rightly mentioned, is that they are targeting girls aged 10. And by targeting that, it's actually been informed by a statistic that says that by the time a girl is reaching 12, 13, a good number of them have actually started being sexually active, which is actually a very shocking statistic. But the idea of targeting them before they become sexually active means that you're giving them a line of defense against a potential killer before they get exposed to it. And you find that every time a vaccine is developed, it's actually been a very common thing that just like when vaccines for polio, smallpox, and so many other vaccines which have now joined our national program of immunization, a lot of them faced similar resistance because there are those who sit back and say that there are chemicals inside these vaccines which will adversely affect people, and people could react to them adversely, and they could do things like hinder fertility or have an acute reaction to them. But by and large, the technology that has been used to develop these vaccines means that you're giving this vaccine in what you call a medium, what you use to deliver. The medium is what you use to deliver the vaccine. And the media for delivery of these vaccines have been shown so far to be safe. And among the countries that have been using these vaccines for a long time, they've not shown these side effects that are currently being propagated as myths. So the vaccine so far has proven to be safe. It's been shown in very many other societies to be effective. And if an intervention has been shown to be safe, it's effective, it's reducing disease burden, and it is reducing opportunities for a life-threatening disease to develop, then it even becomes unethical to deny our women the opportunity to be protected from something that could kill them.
Okay.
Yes.
What is Nairobi Hospital doing to address matters cervical cancer? We are from the January 19th. We commemorate the world, or rather, is it a week of cancer?
The Cancer Awareness Week.
The Cancer Awareness Week, the Cervical Cancer Awareness Week.
Yes.
And I know it comes with screenings and all those services that come together to prevent the disease. What is Nairobi Hospital doing on it?
So the Nairobi Hospital has a team of dedicated consultants within our hospital, and within that team, we run a dedicated clinic, and within that clinic we have consultants who will offer screening of cancer of the cervix. We have multiple methods of screening available, and for those who are found to have a problem that requires to be addressed, there is direct connection within the unit so that you can access specialists. And we have a very high-end cancer center within the hospital that actually directly deals with all these issues. Over and above that, this vaccine for cancer of the cervix is actually available within the hospital. So anybody who is willing to come and have it is actually welcome to do so.
So early diagnosis still remains the #1 prevention of cancer of the cervix?
To date, yes. But now we are looking to have the vaccine take over as the #1 spot, because if your first line of defense becomes overall prevention, then your second line of defense becomes early detection. Because if you can prevent it altogether, then you reduce those who are detected. And if you reduce those who are being detected, then you actually overall reduce the number of those who need treatment. Yes.
Okay. A take-home message to our listeners?
So I think for everyone who's listening, the parting shots would be 2. Number 1, cancer of the cervix is preventable. And if we take the opportunity for prevention, then we have the chance to reduce the disease burden by up to 80%. Number 2, for those who have already been exposed to the human papilloma virus, there is an equally great opportunity for early detection. And if we can improve what we call our health-seeking behavior, that means going for regular checkups in a dedicated way, then we can eliminate death from cancer of the cervix.
Asante sana, Daktari.
Karibu sana.
To Daktari, thank you very much for your expert opinion. And to our listeners, please do take this opportunity to find out the status or the state of your cervix. I've been your host, Modoni Waweru. Till next time when you're discussing about childhood cancer. Thank you.